That's great. And thanks for the comments about Project Reach. We have another Project Reach presenter coming up now, actually from Reston, Virginia. Why don't you come on out, Joshua and James. Joshua Temkin, the VP of Healthcare at Qbase, and James Horner, a software engineer, senior software engineer at Qbase. And their app, I think, is called Almost Reach. Thank you.
Good afternoon. I'm Josh Temkin. This is my colleague, Jim Horner, and we're here from Qbase. So let's give you a little bit of background about us, and we'll talk about our app and what we're doing with Project Reach at this point. Qbase is a data company. We're pretty much focused on data quality, data enrichment, and data enhancement. And we build both custom applications, and we have IP and tools that are really aimed at understanding customers' data in terms of how to improve aggregation. We also have other tools that help geo-encode data. So when we learned about Project Reach, we thought this was a nice use of our tools, which have been primarily used in the Intel community, to start putting them to a greater cause. So really some key problems that we looked at and thought about when we looked at Project Reach was how can we aggregate data in real time so that we can make it accessible on a mobile application and ultimately put it out for the resources to be used. So we focus on the following things: real-time data integration of the shelter bed availability, geo-encoding of each service place so that we can enable searching, and then ultimately how do we clean up that data and make it useful. We also wanted to make sure that this scaled beyond New Jersey. So we put an architecture and platform in place that ultimately can hold data from anywhere in the United States. And in fact, our application today is holding 42,000 places and services. So although the shelter bed application is focused only on data from New Jersey, because that's where we have the feed, we actually have data encoded for food bank, legal services, transportation, and other services which we'll show you across the United States. We wanted to make sure that that data was updated frequently. So we built a full ETL and encoding process that's on the back end that's well, at least once a day updating the data that's in our software application so that it's current based on the sources that we're mining. We want to make it mobile as well as web, and we've currently built an iPhone and iPad app, which we can show you the iPhone. The Android app will be released as part of the beta test, and then the web-based application is available today. So these are the data sources that we're using as part of our application. We have shelter bed availability data from the New Jersey HMIS system. We have legal data from the VA. Mental care facilities are being pulled from the SAMHSA website. Healthcare data from HRSA. VA facility data also is being pulled from the VA. Jobs data, we're using the web service available from the National Resource Directory. Transportation data is being pulled from the dav.org. That one's being updated manually as it's a PDF file at this point. And then we've also been mining other resources that are available on the web for shelters and food kitchen and food bank data from HUD and some online resources. And then we have a database that allows us to add hotlines to the system so that they can be pulled dynamically from our application and website. So kind of give you an idea of what our app flow looks like. We decided that the fewest clicks are the best clicks possible. So we wanted to put together a menu system that was pretty easy and helps drive the user to the specific information that they may be looking for. So we've given them a first menu of the various types of searches of data that we can actually put into our system. That once you pick a search, such as a shelter search, we can actually start to drill down based on metadata to start to filter that search down to the exact specific types of shelters that your client may need or your homeless person may need. So we can filter it based on all the shelters available, things that are based on transitional housing, emergency shelters, and so forth. And then we can even further search the database to filter that result set down based on the type of beds that are available at that type of shelter. We also have added the ability to ask the question, are there open beds or are there closed beds? So we can give you all the information on all the shelters and all the beds, or we can just show you the ones that just have open beds. So if you're trying to find and help someone in need who needs a bed for the night, we want to bring back the shelters that have open beds at that given time. The results are shown in 2 phases, either on a map, which is displayed here, or on a table, which allows you to then click into the details. The details give you the ability to find directions, call the person, go to the site's website, get specific information about the attributes and other services that that particular place may hold. So certain shelters may have services such as soup kitchen availability, mental care facilities, or other things within that site that may come up. So we've given you a full detail screen to be able to do that. So we've talked about some key features, and if we can flip over to the Elmo here, and I can show you the phone. So log into my phone and excuse my daughter. So I have right now the screen up on the iPhone as a user would see it for searching for shelters. So as I mentioned, we could either look by current location or by address, and I'm going to go ahead and search by Red Bank because our current database is pulling the data out of the New Jersey registry. And I'm going to say it's 5-mile search, give me all the shelters, all beds, and we'll give all bed types, and we'll look for all beds, whether they're open or closed at this point. So I'll go ahead and run a search. So what this is doing is in the background, it's actually hitting our data repository and RESTful web services that are actually bringing back this information. Given the signal in here, it's pulling down images of the site, so we have on our website the ability to actually configure each shelter with a specific logo or with a specific icon, and then give you the information here. So you can see right now that the HAB core has no open beds available to it, and if we click the details on it, we can see when it was last updated. And it was last updated here at 11:17 this morning. So we are pulling this data in semi-real time. The bed data is being updated on the New Jersey side, I believe, every 6 hours, and we're pulling every 4 hours just to catch it on the off windows. So we can also do things like look at it on the map, and the map gives you a visual representation of this data so that we can show you by colored pins. Green shows you which sites within that radius that I search have beds. Red show that the sites have no beds available to them. And by clicking on the pins, it can actually bring up the information just like the table, and you can then drill the details. So if I click on the phone number, it will actually dial HABCore. Or if I can click on directions here, it will throw me out into the map app and hopefully pull me up and tell me routes. So if I needed to give someone walking directions, I can use the features of the phone to actually start to give more information to the client to actually find the place or from that current location to move it over. So that's the kind of basics of what our app does and the types of data that we're pulling in. So right now, as we mentioned, our website is available. You can hit this now at your convenience. It's challenge.qbase.com/reach. We have an iOS iPhone app, which is a universal app. It actually will work on an iPad as well. And we're in the process of submitting that to the App Store. If you're interested in participating in our beta, we're running a private app store through a partner company that we work with, and you can contact us and we can hook you up with our beta site so you can actually download the app. So the current version of Android is being worked on and being developed, so we hope to have that ready for the beta tests. And we're seeking new data to import. So as I mentioned, we've already encoded about 42,000 places from the various data sources that we have. And we also have another app, which we're not demonstrating today, which is a VA shelter bed app. Because one of the challenges that came up in this app was real-time bed availability. So one of the advantages of our platform is that shelters can actually register through a named user account in our app to say, I own this place or I manage this place. And we have another mobile app as well as a website ability to check people in and check people out. So beyond hitting the 4 hours, if they were to use the app, they can update, or increment or decrement the open bed count in real time, which updates that data in the database and is ultimately pulled out to the other homeless reach app that the majority of clients would have in this case. So we are here at the HDI in the VA's Project Reach booth. We're very happy to be there. We'll be happy to give you a full demo of our application and software. And lastly, I just wanted to talk about Christopher Moscow. Chris died recently while serving his country in Afghanistan and was a friend of the family of Qbase. So in memory of Chris, Qbase has decided to donate our proceeds from the Project Reach Foundation in his honor to two great foundations that help our veterans. This is the Wounded Warrior EOD Foundation and the EOD Memorial Foundation in his name. So we'd like to thank you for giving us the time to talk today, and we will open it up for any questions. Thank you. Okay. Yeah.
Hi, sorry, I have a question.
Oh, sure. Sorry I didn't see you.
I was just curious about the audience for the app.
Sure.
Who is it?
So that's a great question. So the audience that we've really targeted would be people who would be helping homeless people.
Okay.
We don't anticipate that necessarily a lot of homeless veterans or homeless people in general will be walking around with iPhones and data plans. But to that end, we've also made a website available. That website can be accessed by a homeless veteran or a veteran in a public library, for instance, and he could search for the same sources that someone who actually had the app would be able to give him that same information. So if he went to a library, he could go to the app, he can go in and type where he is, search within a radius. Oops, my session expired. Sorry. And pull up the same information. But the idea was basically to make the information available to people who help homeless people, but then also by giving the public website to make it available from a public library, and so they can basically do the same kind of searches. So the same information that's in the app is available also on the web, and the same kind of filters apply as well. So they can start to filter down the data that they get back based on the searches. Yep, sure. Are there any other questions? Okay, well, thank you very much for your time.
Thank you. Thank you. Thank you to our friends at Qbase. We look forward to hearing more from your developments later.